At Providence, the care of the poor and the vulnerable comes up in every conversation. We are always reminding ourselves that that is why we are here, that is our mission. And there's no more vulnerable period of your life than being a newborn. One thing that people may not be aware of is the fact that over the last century, we've made tremendous strides in reducing maternal and neonatal mortality. What is surprising within that is that over the last 2 decades, that rate has actually increased. In fact, ProPublica recently described the United States as the most dangerous developed nation in which to give birth. And that's scary. As a nation, we can do better. And at Providence, we know how to do better. We're putting in place something called neonatal teleresuscitation. And so we're using technology to actually connect the team in one of these smaller hospitals to our resources in our bigger hospitals. And in so doing, they can help to coach the team in the rural environment and help stabilize that baby and prepare the baby for transport. Things like this save those babies' lives.
Providence cares for more children in Oregon than any other health system, and in fact, 1 in 5 babies are born in Providence hospitals in Oregon. Providence doesn't just care for the small fraction of children that have rare diseases, but also things like asthma and diabetes, behavioral issues, neurodevelopmental issues, and so the impact that we have is much larger. Part of providing the best care for babies and children is supporting research. We were recently involved in a national study around the umbilical cord at delivery for our smallest premature babies. There's data to suggest that giving them a transfusion of blood from the umbilical cord can improve their overall outcome. That work is really important because it may affect the way we approach deliveries for all babies everywhere.
A large percentage of heart disease, diabetes, and other serious illnesses can be prevented before kids turn 10. And adverse events like malnutrition, abuse, and housing insecurity, even before they turn 2, can decrease a child's life expectancy by up to 20 years. A healthy childhood is truly the best preventive medicine. A healthy childhood starts with a healthy pregnancy, and a healthy pregnancy starts with a healthy woman. That's why we've created the safety net for families to make sure that families have a strong start. This program provides at-risk families with housing assistance, nutrition assistance, and any other necessities to create a healthy, safe childhood.
Health for your lifetime starts in utero. And the work that we do to help a woman be healthy, to help a family prepare to welcome this child into their home, impacts that child's life. And it's our moral obligation to care for these newborns and to support their families in a way that ensures that they're off to the best possible start.
Babies can have trouble breathing, they can have difficulty eating, they can have problems with low blood sugar, they can have problems with severe infections. And our job is to guide them through that, and that work is hugely important because it sets them up for their entire life.
At Providence, we believe that creating healthy children creates a better future for us all, but we can't do it without you. When you give to children's health, you are truly changing the future.